All persons should have equitable care. So we're doing a disservice to all of our patients when we provide a high level of care for sexual assault victims, but we aren't providing forensic, evidence-based, trauma-informed care to everyone who has experienced some form of violence. Often it's because there's a limitation in healthcare provider training. Alaska faces a lot of challenges. Geographically remote, we have significant weather issues, and so we often have sexual assault victims who need response within that 5 to 7 day window, and they don't have forensically trained providers in their community. The Alaska Comprehensive Forensic Training Academy is a two-part opportunity for all healthcare professionals, whether you're EMS or health aide or nurse, doctor, NP or PA, to obtain kind of a generalized forensic training to be able to respond to all of their patients, regardless of age, gender, socioeconomic status, or location. I would say that our mission statement is to train healthcare providers to be able to respond to all victims of violence so that we are providing patients with an equitable level of care regardless of who they are.
This program will make a difference for our society overall in the health of our communities. It's through all of us that we can advocate for training of our nurses in each of our communities as a generalist forensic examiner. Having the training for medical providers, healthcare professionals, this is going to make a difference for our people who are the first people of this land to understand how we can better care for first Alaskans.
It's extremely important to provide this training to people that are in the healthcare field, because otherwise we have just a large portion of our population who are victimized by different types of violence that are just simply not identified.
So the ideal goal would be for healthcare personnel, nurses, doctors, PAs, NPs, EMS to be able to recognize the signs of violence, the different kinds of wounds that are happening or that have happened to them, and to be able to document them. That's the most important piece, that they're able to document. Oftentimes, victims don't necessarily need evidence collection other than, say, maybe some photography, but it's the documentation that is absolutely essential and the trauma-informed care. And so the combination of those two pieces make it easier for law enforcement at a later date even to come back and be able to utilize that information.
Part one, the student takes self-paced learning online, and then part two, the student actually has an exam. It's an interactive exchange in the patient room where the student comes in and then there's an actor in the room that the student conducts the exam. So this portion of the training actually allows the student to achieve their certificate of completion.
These training sessions have helped me evaluate the situation by giving me time to practice and practice again. Anytime that we've been in a position of high intensity and high stress, we don't want to see something for the first time. So being able to undergo this training has helped me feel more comfortable in offering and lending my support to the victims.
What I see for victims of violence is that we begin to reduce the number of victims. I believe that through this training academy, we can do a better job of getting evidence quickly, getting it accurately, and being able to move cases forward through the system to conclusion. I would like to see the vision for Alaska is that we are able to actually collect data and carry out the necessary cases so that we can end domestic and sexual violence as well as other violent crimes in Alaska. That is my ultimate goal, is that we start ending the high rates of violence in Alaska.
It would be my ideal future that every patient receives care that includes forensic principles of trauma-informed care and evidence-based practice when it comes to documentation. If there's a need for evidence collection, which doesn't always happen, but if it does, that they have providers that are comfortable because they know how to do it and they know how to recognize it. The entire goal for the Academy is to provide that training to all levels of healthcare personnel. We want people to be comfortable and confident in, one, knowing how to provide the care, and two, knowing what happens so that they can talk to their patients about how important it is and give them the resources that they need.
Go online, just search for Alaska Comprehensive Training Academy, and the registration is right there.